Hi, my name is Ken Fickler. I'm the founder and CEO of Gaze, and today we're going to talk about oral fluid drug testing and some of the limitations that it has. As more and more places around the world embrace the legalization of cannabis, the challenge of reliably detecting cannabis impairment has become increasingly important. Now, it's tempting to use the traditional chemical tests for this purpose, and after all, that method has worked pretty well for alcohol. However, the tests for alcohol impairment, such as breathalyzers and blood tests, are rooted in well-established science that correlates blood alcohol content, or BAC, with impairment levels. And this is appropriate for alcohol because it's linearly metabolized in the body and because the impairment that's experienced mirrors the amount of alcohol that is in the body. The same is not true for cannabis or virtually any other drug. Thanks to dozens of rigorous scientific studies, there is now consensus in the scientific community that measuring delta-9 tetrahydrocannabinol, or THC, levels in the body cannot determine current impairment. Said another way, measuring THC in the body cannot tell us if someone is currently impaired. This post includes a very short overview of how THC works in the body, but if you'd like a much expanded exploration of this topic, we have a whole blog post on our website, gaze.ai. Now, delta-9 THC is the primary psychoactive compound found in cannabis. It's been long the focus of traditional drug tests looking for past use, like saliva and blood tests. While alcohol impairment can be measured by quantifying blood alcohol content, the same approach cannot be used for THC. And it's been proven to be totally inaccurate for that purpose due to key differences in how these substances behave in the body. Alcohol is water-soluble and metabolized relatively predictably and in a linear fashion. It clears from the body within a number of hours. In contrast, THC is fat-soluble, meaning that it's stored in fatty tissues in the body and released gradually over time, leading to a much more variable rate of metabolism and radically extends the window of detection. THC creates its psychoactive effects by binding to CB1 receptors in the brain shortly after consumption, and this causes the characteristic high that users experience. However, after the initial metabolism in the liver, THC is converted into metabolites that linger in the body for weeks or months that are not directly related to any ongoing impairment. This is why the high from cannabis use lasts 90 minutes to 2 hours on average, much longer potentially for edible THC. The biggest challenge in using THC levels as an indicator for impairment is the discrepancy between how long THC and its metabolites remain detectable in the body and the actual duration of psychoactive effects. For example, a person may test positive for THC for days or even weeks after the last use of cannabis, much longer than the experienced impairment, of course. This contrasts sharply with alcohol, which is metabolized much more quickly, and the impairment closely correlates with the presence of alcohol in the bloodstream. The bottom line here, what you need to take away, is that the key challenge of detecting cannabis impairment is that THC can remain in the body long after its psychoactive effects have worn off. That's very unlike alcohol, where the presence of the substance and the impairment are closely aligned. Oral fluid drug tests, which detect the presence of drugs like THC in saliva, have been proposed as a tool for identifying marijuana and other drug impairment in drivers and workers. These tests are often favored for their non-invasive nature, relatively, and ease of administration. However, a vast number of scientific studies have shown conclusively that quantifying THC in the body of a marijuana user is not predictive of any experienced impairment. Oral fluid tests are no exception to this, and THC can be detected in saliva for at least 48 hours after consumption. This is, of course, radically longer than the window of experienced impairment, and therefore these tests should not be used for detection of impairment and should be limited in scope to determining if someone has recently used marijuana. This means that an oral fluid drug test commonly will produce a positive in cannabis users even if the individual is not currently under the influence of cannabis. And we've cited a bunch of studies that demonstrate this point in the blog post that I'll link below the video here. Suffice to say, there have been dozens of studies that have investigated this issue and universally come to the conclusion that measuring THC in saliva cannot predict impairment. The body of research on THC and impairment clearly and consistently demonstrate there is no reliable correlation between THC concentrations in the body and actual impairment. These studies show that while THC may be present in blood, oral fluid, or other biological samples, its concentration does not provide a clear or consistent indication of an individual's impairment. THC levels can vary significantly depending on factors like metabolism, tolerance to cannabis, and the time since consumption, which makes it extremely unreliable as a predictor of cognitive or motor skills necessary for activities like working or driving. Some studies even report unimpaired individuals with high levels of THC and conversely, impaired individuals with very low or undetectable THC concentrations. As a result, relying solely on THC levels for determining impairment is scientifically baseless and totally flawed. Now, this finding has significant implications for the use of oral fluid drug tests as measures of cannabis impairment. Oral fluid tests, often used for roadside and workplace testing, measure past cannabis consumption but cannot accurately assess the current level of impairment. Since THC may remain detectable in oral fluid long after its psychoactive effects have subsided, such tests risk flagging unimpaired individuals as impaired. These limitations suggest that current biological tests for THC, including oral fluid tests, are not suitable for determining real-time impairment and raise real concerns about their fairness and effectiveness in legal and workplace settings. Since this can have massive implications for employment and criminal charges, the use of oral fluid tests as impairment tests should be avoided. This issue has been very thoroughly studied and the results are conclusive. Oral fluid testing for THC is deeply unfair to safe and responsible cannabis users when used as impairment tests. One study even found that THC was detectable in oral fluid in a cannabis user for 8 days following the last administration of cannabis. This is a real challenge, and workplaces and roadside use of oral fluid tests should be limited to only detecting previous use of cannabis. In addition to the fundamental scientific issues with using oral fluid tests to assess impairment, there are also significant concerns about the accuracy of the leading devices that further undermine their reliability for this purpose. Oral fluid tests are notoriously prone to false positives for THC, which can arise from a variety of factors beyond actual cannabis use. Exposure to secondhand marijuana smoke, cross-contamination, certain medications, and even consumption of specific foods can all trigger a false positive result. The lack of testing specificity means that individuals who are not impaired and may not have even recently consumed cannabis could then be incorrectly flagged as under the influence. Evaluations of popular devices like the Draeger Drug Test 5000 and the Abbott Sotoxa highlight these flaws. Studies have shown a 14.5% false positive rate for the Drug Test 5000 and for the Abbott Sotoxa an 11.2 to 24% false positive rate. Now, despite these high error rates, these devices are being actively used in Canada and several US states, including Minnesota and Indiana, and more states are considering their implementation. The widespread use of these flawed tools poses serious risk to drivers and workers who could face unjust penalties due to inaccurate test results. Fortunately, in many jurisdictions, drivers still have the right to refuse these tests, which is a critical safeguard given these devices' unreliability. As more states evaluate the use of oral fluid tests, it's crucial to weigh their actual technological shortcomings and their potential false positives against their intended purpose. So why do these tests persist? At this point, the limitations of oral fluid drug testing has been well established, and despite these significant limitations, oral fluid tests are still used in many legal settings, particularly in some states for roadside drug testing. Many businesses also use them for maintaining workplace safety. The reasons for this are multifaceted, but first, saliva tests are relatively easy to administer and can provide quick results on site. Law enforcement agencies favor them because they can be performed without the need for medical personnel and give a rapid result. Moreover, these tests are seen as a deterrent to driving under the influence, much like breath alcohol tests. Deploying oral fluid tests in this way is, however, deeply unfair and unethical, given the many problems we've already discussed. Their legal use raises real questions about both fairness and accuracy, given that oral fluid tests did not indicate impairment. Individuals who use cannabis legally, whether medicinally or recreationally, may face consequences that do not align with their actual ability to operate vehicles or perform other tasks safely. As with other chemical tests, saliva tests disproportionately impact marginalized communities as well. Saliva tests are more likely to be used against people of color and those from low-income communities. This is because these communities are more likely to be targeted by law enforcement, and more specifically, over-policed communities will certainly be targeted by these tests. Now, given their absurdly high false positive rate, these populations will experience an even greater disparity of negative policing outcomes. And this has been studied by the ACLU, and we've linked to that study as well in our blog post that I'll link below. So what are the alternatives to oral fluid drug tests? The glaring limitations of oral fluid drug tests demand shift toward a more accurate and reliable method of assessing cannabis impairment. Now, fundamentally, what is needed is a testing technology that fairly and accurately detects cannabis impairment as it's being experienced, not past use. Impairment detection technology is the right solution because it evaluates actual performance rather than relying on outdated biological measures like THC concentrations. Physiological and cognitive testing is at the forefront of this movement, offering real-time functional assessments of a person's ability to perform a task safely. Clinical research is emerging that shows that these tools offer clear and deeply accurate means of assessing a person for current impairment. For example, a 2020 study that was published in Frontiers in Psychiatry demonstrated the potential for a digital cognitive test, such as those measuring reaction time, attention, memory, and other assessments to detect impairment. These tests provide a direct evaluation of current ability, addressing the critical issue of real-time impairment detection rather than relying on indirect markers like THC levels. In particular, eye tests that test for things like pupil reaction to light and gaze characteristics have long been used by human drug recognition expert police officers to assess non-alcohol impaired driving. These tests have withstood court scrutiny and scientific inquiry for over 4 decades, and they've emerged as highly predictive for cannabis impairment. Gaze has utilized these same law enforcement tests to create a fully automated impairment detection device that uses cutting-edge eye tracking technology. This tool has the ability to measure subtle changes in eye movement and pupil behavior that are conclusively linked to cannabis impairment. Gaze offers objective and science-backed alternative to traditional chemical drug testing methods. Now, unlike oral fluid and saliva tests that cannot be correlated with impairment, Gaze focuses on measuring the mental state of an individual via eye movement, ensuring that cannabis users are evaluated based on their actual ability to function and not just the presence of THC in their system. Now, this approach is not only more accurate, but also far fairer, ensuring that those who are unimpaired are not unjustly penalized for past use of a legal substance. As we move towards smarter and more effective solutions, it's clear that technologies like Gaze represent the future of cannabis impairment detection, which sets a new standard for both safety and fairness. Now, in conclusion, the scientific consensus is clear. Oral fluid tests cannot detect cannabis impairment. Full stop. While these tests are generally effective at detecting previous cannabis use, they are not a valid indicator of whether a person is impaired at the time of testing. Factors such as individual tolerance, the method of consumption, and the time since consumption all contribute to this disconnect between THC levels in saliva and actual impairment. In pilot deployments in the US and Canada, oral fluid drug tests have been shown to produce unacceptably high false positive rates. This means that even drivers who have not previously used cannabis may be arrested for impaired driving simply due to poor quality tests. Further, states doing oral fluid drug testing are aware of these shortcomings and are using the tests anyway. This is an outrageous decision, particularly as more and more damning evidence has been released. As one example, Minnesota is now, as of 2024, launching an oral fluid pilot program using the same equipment that has produced terrible results in other states. In fact, that state's top law enforcement officials have knowingly and improperly characterized oral fluid drug tests as impairment tests. As cannabis legalization continues to expand, the need for more accurate and reliable methods to assess impairment grows. Tools like Gaze's impairment detection technology hold the key to addressing this challenge. Relying on oral fluid tests risks punishing safe and responsible cannabis users who may test positive for THC long after any impairment has subsided. There is absolutely no scientific data to support the use of saliva tests for detecting acute marijuana impairment. And the fact that states are deploying these tests for that purpose is both unfair and unethical. Impairment detection technology is deployed today and has been clinically proven to accurately detect cannabis impairment. I would look forward to answering any questions you may have. You can reach out on our website or by contacting support@gaze.ai. Thanks for your time today.